Mental professionals, what is the worst mental condition that exists? Prosopagnosia. I had a patient with this as a therapist. They reported to the ER because their face fell off. The only thing therapy could accomplish was to teach the patient how to use other markers to identify people. Capgras syndrome. The idea that people around you were replaced with imposters. This one is an absolute nightmare on everyone. And in neuropsych, definitely primary progressive aphasia. Basically, you aggressively lose the ability to speak and understand language. I had a patient once that was late to their appointment, and when they finally got there, they were so upset because none of the signs were in English. They failed all of their English tests but passed all the other markers to rule out dementia. This person was an avid runner, vegan, perfectly healthy, and would likely go on to never be able to speak or understand anyone speaking to them within 5 years or so, yet live a long life due to no other health concerns. Okay, before we go any further, I would just like to apologize. One, because I'm probably going to mispronounce a lot of stuff, but also two, I got a feeling this is all going to be very scary and sad, so just a heads up, strap in, stay safe, pray for your loved ones. Story 2. Cotard delusion. I'm a nurse and had to take care of a huge man with this condition. He came in with some odd behavior and escalated to Cotard. This delusion makes you think you are actually dead. He would scream he was dead all day and all night. He lived in constant terror. He was such a sweetheart, but he became just so worn down and terrified over time that he got kinda dangerous and even punched a nurse in the face. Story 3. Schizophrenia. Hands down, no contest. 90% disability rate. 30 years shaved off of natural life expectancy. Astronomical self-unaliving rate. Common comorbidities include both mental health and physical disorders. Some people still think that schizophrenia is DID, which obviously it is not multiple personalities, but a less ignorant, even more common misconception is that schizophrenia is a monolithic disease. That is, it shares an underlying pathology between cases that causes it. The reality is that schizophrenia is nothing more than a cluster of symptoms, and there are many different pathologies that can lead to these same symptoms. Part of the reason schizophrenia has a reputation for being the be-all and end-all of insanity is because you cannot go more crazy than schizophrenia. It does not exist. Schizophrenia is the end of the road for all madness. So this blew up. Apparently I could use some extra clarification. The thing that makes schizophrenia so dangerous is not the disease itself necessarily, but because it almost never exists in a vacuum and it's never isolated from other disorders. The extreme amount of comorbidities with schizophrenia, including practically every other mental illness and some physical illnesses, is what makes it such a killer and the major contributor to shaving decades off of someone's lifespan. Many people with schizophrenia will self-medicate for their symptoms, and substance abuse definitely does not help. That's not even mentioning the meds. They suck, even if they work to control psychosis. The side effects are legendary for how awful they are. You pack on pounds like it's nothing. Some of them can cause diabetes to manifest, and any number of other terrible side effects, aka aesthesia, aka perpetual restlessness. It is all the be-all and end-all of madness because it bleeds into everything that you are. Story 4. Though not a medical professional, during my brief time working at an outpatient facility, I encountered a patient with body integrity identity disorder, BIID. Convinced that his arm wasn't his own, he consistently described it as a feeling like a stranger's limb. His intense desire to have his own arm removed led him into a deep depressive episode, culminating in self-mutilation attempts that ultimately needed amputation. Post-surgery, he claimed to finally feel a sense of peace. However, I left the job, so I don't know the lasting impact on his mental state from the surgery. BIID is still a relatively unknown identity disorder and doesn't have many treatment options so far. SSRIs are usually given to alleviate depressive symptoms, but it doesn't always seem to help. Going through something like this just seems like an awful experience. Dealing with all those obsessive thoughts nonstop, that's gotta mess with your head big time. All these are so scary and sad at the same time. It's heartbreaking in the way that it's so horrifically unfair. It's not like they did anything to deserve their brain to kind of trick them, And God knows I've done nothing to earn my own sanity. Story 5. Delusional parasitosis comes to mind with this prompt. I've watched a patient go to well over a dozen doctors trying to get a confirmation that they're parasite-ridden. After countless stool samples, blood work, labs, scans, biopsies, etc., she clearly doesn't have any but remains convinced. Story 6. Have a friend who works with seriously disturbed patients and told me about a woman that habitually drank hand sanitizer. Apparently, when you do that, your joints lock up and you have to be immediately rushed to the ER for treatment. And what do they have in the ER? Every 10 feet or so? Yeah, more hand sanitizer. So this woman would have to be restrained, otherwise they would find her in the hallway pumping it directly into her mouth all over again. Story 7. Anorexia and borderline PD have the highest all-cause mortality risk and self-unaliving risk. Both reduce life expectancy by about 20 years, and if they're in combination with other disorders, substance abuse, etc., even more than that. This is partly because of the increased self-unaliving risk, but also due to factors like increased risk of unhealthy lifestyle, the combined metabolic burden of substance abuse and medication, and the effects of constant stress. Also, increased risk for blood-borne diseases and STDs, like hepatitis, because of risky sexual behavior. 10% of people with BPD unalive themselves. For BPD, this percentage is skewed heavily towards men. 20% of men with BPD will unalive themselves, but only 5% of women. This is at least partly because men often choose more immediate methods like jumping or firearms. That's not attempts, that's actual self-unalivings. More than 3 out of 4 people, 79% with BPD, attempt to self-unalive themselves at least once in their life. Story 8. Clinical depression. Sitting in a room with someone and you can feel the void around them. It's like a complete emptiness. I worked with someone who accidentally set their bed on fire while smoking and was just watching it like they were watching daytime TV. Zero emotion and zero reaction to move from it. It's chilling. Story 9. Childhood disintegrative disorder. Nightmare fuel of the highest order. The child starts to regress in development language and speech starts deteriorating. Acquired motor skills, losing ladder control, progressing until they are vegetative and non-communicative. The person that the child was has disintegrated completely. We have no idea what causes it, nor any treatments nor detection of it beforehand. But what turns it into pure nightmare fuel is that there actually is one preceding symptom. The child is utterly gripped by fear and intense feelings of something being very, very wrong with them, often complaining to the parents that something is terribly wrong. Story 10. Outside of thought disorders like schizophrenia, scrupulosity OCD is pretty brutal. Basically, it's this fixation on going to hell, and the person is convinced they're going there no matter what. At its worst, it's all they can think about, all they can talk about, distracting them from work and family, knowing that they're going to burn in eternal torment one day slowly drives them mad. Story 11. Not a medical professional, but for anyone interested in these cases, I strongly recommend a book called The Man Who Mistook His Wife for a Hat by Oliver Sacks. It describes different cases, studies including people with aphasia, face blindness, people who feel their body parts aren't their own. A man fell out of bed because he found a strange leg in his bed and threw it out. It was his own leg, hence he fell together with it. Some are the rarer dementias. There's one that literally turns a perfectly normal person into a psychopath. All their other faculties remain intact. There are dementias that literally melt your brain and don't even have a name. There are rare familial types of dementia so specific to certain families that they don't have a name, but can develop really early, and again you know it's coming your way. And then there's Huntington's, which you likely know you're getting and have seen your loved ones go through it first. The embedded hallucinations and Lewy bodies can go either way, very distressing or comforting. With the non-organic illnesses, it's a toss-up between treatment-resistant psychosis and severe emotionally unstable personality disorder for the impact on quality of life. Story 12. Not mental health care, but I work in hospice. The worst case of dementia I ever saw was a woman who had hidden her childhood trauma from her children, when got dementia and her only remaining memories were of abuse. She spent her days scream-crying and trying to break herself out of her room, bloody fingers and all. It was horrific for her family, for her staff, her husband. It was the worst thing I've ever witnessed. Story 13. Mental health care trained, ended up in a different field. Manipulative personality traits. They aren't really diagnosable, they can be treatable, but paying for treatment is a nightmare because it's hard to get a proper diagnosis. Manipulative personality disorder isn't a DSM-V disorder, but borderline personality is. But borderline doesn't cover actively manipulating family and children so that an adult can have an advantage. Manipulative personalities and behaviors create family environments which are hostile and abusive, but nothing can be done until the abuse happens. It's kind of a gray area, which is why I think it's so difficult. Story 14. For any mental health professional, if he or she would ever come across it, it's got to be fatal familial insomnia. There's nothing they could do but watch the patient waste away. If said patient doesn't unalive themselves first, it's exceedingly rare, thankfully only 40 or so cases as of 2022. Story 15. That's a hard one to answer because everybody is so different and their experiences of mental illnesses can be so different. For instance, I've worked with people with chronic schizophrenia with hallucinations so horrendous you can barely imagine, and others who managed the same chronic mental illnesses with totally different symptoms and a high quality of life. I can definitely think of individuals with particular presentations of mental illnesses I would consider to be the worst I've ever seen, but thankfully not everyone with those illnesses will have that same experience. Story 16. I'd say the worst has to be schizoaffective disorder. It's basically a combination of both schizophrenia and bipolar depressive disorder. Yes, when you aren't having a psychotic episode, you're having a manic episode. Schizophrenia is one of the worst mental disorders, but mixing it with another one, that is the worst. Story 18. Anything that comes with unshakable paranoia. Schizophrenia, forms of dementia, people are scared all the time with no way out. Attempts to soothe the many worries usually get sucked into a whirlpool of delusions and transformed into another reason to be afraid. Also creepy, a symptom of severe alcohol damage is seeing vermin crawl around. In the easier version on surfaces around the room, in the bad one, they're crawling under the skin. No pink elephants or white mice, rather cockroaches, spiders, or bugs. Again, logical conversations do nothing to fix it, if people are even still able to follow a conversation at all at that point. Story 19. I have a mental illness and living with it is horrible. If you ask me, they are all horrible for a person living with it, wanting not to be alive but knowing you cannot inflict the pain and suffering to family members, knowing you being here and your family members supporting you is still causing them pain and it's so hard to deal with. Holding down a job and being a productive human is all time-consuming and exhausting. I'm grateful to be alive, don't get me wrong, have the support. I understand I will have to be medicated for the rest of my life. Story 20. My wife is a therapist, had a client with FND, functional neurological disorder. This means they had the symptoms of a neurological condition, in this case, seizures, but there was nothing physically wrong with their brain. In my opinion, it's one of the worst ones because you're basically told, it's all in your head and there's nothing we can do about it. There's very little information about how to treat it, and doctors don't take it as seriously as a neurological condition that shows up on the brain scan. Story 22. Munchausen by proxy. Never saw it in the field. It's rare, but learning about it in class was sickening. The other worst ones by category. Mood disorder, bipolar, manic episodes specifically. Thought disorder, schizophrenia hands down. Anxiety, PTSD, specific cases. Personality disorder, all of them, but notably histrionic, borderline, and narcissistic substance abuse disorders. Any hard drugs that caused or intensified hallucinations. Story 23. I know it doesn't quite compare with schizophrenia and other things in this thread, but ADHD, especially untreated, it's a nightmare. It will ruin your life if you let it. 80% of people with ADHD develop a mental disorder because of it. 20% of people with it attempt self-unaliving at some point. Individuals with ADHD have a 6.5 increased risk of experiencing depression with a 3-fold increased risk of having dementia later in life. One of the worst aspects is that from an external point of view, it looks like laziness and unsociability. And so a lot of people think it's made up to prescribe pills to children. If they could live a few weeks in our shoes, I bet they would be more empathetic. Story 24. Huntington's disease. I'm a master's student and my research work is around HD. It has the symptoms of Alzheimer's, schizophrenia, and Parkinson's combined. Although it affects 1 in 10,000, it is a genetic disorder where even if one of your parents has the mutated gene, you definitely have a 100% chance of getting it. People have gone to extreme lengths of sterilizing their reproductive organs in order to stop passing down the gene. It is a progressive disease, and it only gets worse with time. Starts with muscle twitching to involuntary movements, inability to speak, and full muscle paralysis. The symptoms get worse with time. In fact, it gets so much worse that at the end, the only relief is death. Life expectancy is max 30 years after the diagnosis. Story 25. Not a therapist, but I dated someone with DID who was in a lot of therapy. While it's probably not the worst, it's definitely not something you'd wish on anyone. It's very disruptive, there's no medication for it, and psychologists can't even agree on what it is or how to treat it. Story 26. Schizophrenia. I know dementia is terrible, but at least most who have it have a normal life most of their life. Schizophrenia is a range of conditions, but all of them are so insidious because the person may be very intelligent but doesn't understand that their strange thoughts and voices aren't normal. It's all a conspiracy, and everyone knows, including the doctors and medications. There's literally no win. Story 27. Not a condition per se, but I bet there are more horrible things. Appearing or being perceived by others as more mentally handicapped than you actually are. Imagine being treated like a small child at all times, no matter what you say or do. Your whole life and all familial connections have long since stopped visiting. It's isolation, even when around social people all the time forever. I had a patient who had regressed to an infant state, and in talking with them and working with them, I got them toilet trained, doing their ADLs, participating in activities, expressing themselves, eating independently, and dancing. They got discharged back to their residence where they were treated like a severely handicapped person. Within 3 weeks, they had regressed back to the infant state. 3 months gone in 3 weeks. Be kind to people for no other reason. I'm a psych nurse in a psych hospital in Canada.